webinar which has been organized by Disability and Development Consortium India on poverty, hunger, and disability, the missing link. Mr. Amitabh Behar, who is CEO of Oxfam India and is very passionate about governance, accountability, social and economic equality, and citizen participation. I have the privilege of knowing Amitabh Bhai for some time, and over the years, he has worked on building people-centric campaigns, Alliance for Social Justice, and linking micro-activism to macro changes. Amitabh is one of the leading experts of people-centered advocacy and chairs the board of Nerve Surgeon. He is the vice chair of Civicus and also sits on the board of other organizations like Center for Budget and Governance Accountability, Mobile Crash, WANI, UA, Global Fund for Community Foundation. Over to you, Amitabh Bhai.
I'm here in solidarity and a big salute to DDC for building this coalition. I do really think that in these grim times, in these difficult times, it is the kind of rainbow coalitions that Arunji talked of, which give us hope and inspiration. So thank you, Venki, again, and thank you, Arman, thank you, Akhil, for having me here. So let me just say, the first part I'm going to share a couple of comments on SDGs. Then I'll talk about the inequality report that we have. The third piece, I'll talk of the inequality and in its multiple dimensions. The fourth, I just want to then identify a couple of data points to talk about health and inequality, and then look at 2-3 suggestions that I would want to share with the members of this coalition. So let me just start. To appreciate what you're doing to link the question of disability with the entire Sustainable Development Goals, which I must say is probably the most ambitious global compact that we've seen. Economic, social, environmental, all come together in this framework. And I worked a lot on these questions, particularly when the SDGs were being framed. But let me still highlight, and for this conversation, I think it's critical, a couple of misses in terms of SDGs. The first, and I think it's a big one for this conversation, is that with the experience of MDGs, we were all saying that we need to move from aggregate numbers to disaggregated numbers, which I think we have not been able to adequately address. There is lip service to it, but we have not been able to really break that into looking at questions of Dalits, Adivasis, disability in a very focused fashion. And I think that's a big miss, because the macro numbers hide the reality of people, of particular communities, the vulnerable and the marginalized. The second, again, a big miss, I think is really the idea that we continue talking about eradicating extreme poverty. We thought that it's important, and civil society was making that demand, that from MDGs, we needed to move to a framework of looking at justice. However, largely the conversation is around how do you look at poverty and some basic services. That's again a big miss. It would have been a very different global compact if we were able to bring justice to the center stage of the entire SDGs. So those are two big misses, but I just wanted to say, I'm very happy that we were able to get goal number 10, which is looking at the questions of inequality amongst countries and within countries. So that's important, and that's a big one. And the second big one, I think, is the idea that it says almost as the tagline for SDGs, leave no one behind, and a life of dignity for all. So that's important. And those are taglines which we may need to make real and not let them remain just empty slogans. So having said this, I just wanted to, I talked of old 10. Let me say that we need to look at the entire SDGs in the context of what is really happening in the economic systems that we have and the political systems that we have. And I want to talk specifically about our Inequality Kills report that we released a few weeks ago. So without looking at the larger economic systems, it's unlikely that we'll be able to both comprehend what's happening with goal 1 and 2, which is the focus of our conversation today, and also with SDGs and the questions of disability rights that we are looking at. So let me just present some data points from the inequality reports. And these data points are about the COVID era during the pandemic. During this pandemic, last year in India, we actually saw 102 billionaires. That was the number of billionaires in India. It's now become 142. So an increase from 102 to 142. This is the time that the billionaires in our country actually doubled their wealth, whereas 84% of the Indian population actually saw a loss in their income. So that's the stark contradiction that we see. On the one hand, the rich became richer, and on the other hand, you're seeing 84% of Indian population lose their income. Just to give you one more figure, 98 people in this country have more wealth than 55 crore of Indian population. So that's the level of inequality we are living with. And it's fairly clear that this inequality is not just growing, it's exploding now. And this is because of the economic system that we have created. An economic system which is rigged in favor of the rich and which hurts the poor and the vulnerable. So, I just wanted to bring that in. I think it's important that very often we see the mainstream media also presents as if a growing number of billionaires is a sign of success. We've been again and again making this point that this is actually a sign of failure, a failure of the economic system that we have created, which is essentially lining the pockets of the super rich. And I think, that's something we need to also understand, that this is not happening only in India because we have an international audience. This is a global phenomenon. Let me just give you one global data, that the top 10 billionaires of the world actually doubled their income again during the period of the pandemic. So that's the inequality story that I wanted to talk of. But let me just say that while we're looking at this obscene inequality, which continues to grow, we need to appreciate that inequality has multiple dimensions. And I'm going to just talk about that because, that's so critical. And in some ways, what Arunaji said, what Jean said, automatically, and Akhil, the last line that you said, do already highlight the inequality in terms of people with disability and others. But let me just give you a few other data points to talk of how we need to have an intersectional approach to understand inequality. The top 1% of the global population, in terms of carbon emissions, are responsible for emissions which is double the emissions of the 50% of the global population. So top 1% actually emits double of the carbon emissions of the 50% of the global population. That's the level of inequality. And then we know what it is leading to. We are already now seeing it in terms of the cyclones, in terms of the floods, which essentially hits the poor and the most vulnerable. And that cycle is again something that we need to understand. Just to give you, say the racial angle to inequality. In Brazil, 1.5, 1.5 times Black people died of the white population. So that's during the pandemic. Let me also say, in the US, 3.4 million Blacks would have been alive if they had the same life expectancy as the white population there. That's the level of inequality. And I'll not go into, what Amartya Sen has talked of, the missing millions, that in 2011, at least the data clearly showed that in India, 0 to 6 child sex ratio is 916 girls for 1,000 boys. So these are missing millions. We are not letting girls to be born. That's the gender inequality. And you can just go on looking at the different levels of inequality. I just wanted to now quickly bring in the question of health, because health, as we know, is one of the primary causes of people sliding into poverty. Just one illness in the family, and people go below the poverty line. So let's just look at health, because particularly during this pandemic, we had also done a report earlier, which actually identified several new billionaires, and we called them the vaccine billionaires. So during this time, when people were not able to get food on their table, you saw these pharmaceutical billionaires making huge windfall profits. And this is in India. Let me just, again, as I said, I'll give you 2 data points around health. I just wanted to say, in India, you are looking at super specialty hospitals. You see people coming from all around the world doing health tourism. So you really have the best of the doctors, the best of the medical facilities. But on the other hand, the public health system is crumbling. And we saw that during the second wave of COVID, when people literally were dying, literally, as in we've had our friends die waiting for a hospital bed, an oxygen cylinder, just waiting outside the hospital reception. So that's the level of inequality we see in terms of health. But I want to give you 2 data points, and this is important. Out of pocket expenditure is what people need to pay when they go to the public health system, or for in terms of medicines, the fees, etc. In India, it is 64.2% of the total health expenditure, whereas in other parts of the world, the average is only 18.2. It clearly shows that the public health system does not function, and people have to pay for their own health needs, which I would say is bizarre, where we should be looking at health as a fundamental right, and you actually are paying, and paying much more compared to other countries. Why does this happen? Again, let me tell you, we've just seen the budget. You keep talking about big investments in the infrastructure, but on health, last year, even during the pandemic year, we saw a decline in the health budget. And let me give you now the comparative picture. In India, we have consistently spent only around 1.2% of the GDP on health, only 1.2%. And let me compare this with the BRICS countries. Brazil does 9.2% on health. South Africa does 8.1. Russia does 5.3. China does 5. Even Bhutan, which is our neighbor, does 2.5. Sri Lanka does 1.6. And we have stagnated around 1.25. So that's the level of low investments we make, which then clearly would show how we have poor health infrastructure. Just in terms of, what does it translate into? In some ways, I've talked about it, but we have 43% shortfall in terms of the number of nurses we should have in this country, according to the WHO norms. So that's the health crisis that we are talking about. And just to give you one figure, if I take you back to the inequality report that we talked of, in that we are saying we have done the calculation, just 1% tax on the top 98 families of this country can sustain the Ayushman Bharat for 7 years. Ayushman Bharat, which you know is one of the most ambitious health initiatives globally, can be sustained by just 1% on the top 98 families of this country. So in this, this is the context in which we are working. I just wanted to make 4 specific suggestions, or let me just say 3 specific suggestions. And it's been already said powerfully by Arunaji and by, Arman, you talked about it, Venki talked about it, Akhil, you also talked about it. Ultimately, this is a question of looking at the intersectionality. We will need to look at intersectionality of hunger, of poverty, of access to education, health. So it is a larger, broad human rights framework, a framework of entitlements that we need to look at. So the intersectional approach, how do the LGBT movement work with the disability movement, with the gender, women's rights movement? I think we need to really look at this intersectionality as an approach. The second, I think that's the important point, particularly with what I've said. It's very, very critical that we also look at the macro structures. So the point Jean was making, that yes, it's very little in terms of the pensions, but why is the government of India not spending more than the 200 rupees that we are talking of? There are the larger economic structures that I think we need to engage with. If we don't change the macro structures, unlikely that at the local level, we'll be able to make a dent or get changes. And that I talked of the economic structures, but I think in these times, we also need to look at the democratic structures where the space for democracy is shrinking. And the fourth, I think, which is critical, and this will take back to leave no one behind, and that's the final point, is to bring back Gandhiji's talisman. It is about whatever we do, how do we bring back, the last person, the person who's suffering the most at the center of what we do. And let's not hide behind aggregates. It's really that person who should be at the center, and all our actions need to do something which will help that person. So thank you for having me here.
Thank you very much, Amitabh Bhai, for your very, very refreshing thoughts on inequality, poverty, and also bringing in health as one of the major player and the intersectionality. We are very, very grateful to you for your time. Thank you very much. Webinar, which has been organized by Disability and Development Consortium India on power.